When you first come into treatment, you're going to be given several choices. There are different kinds of treatments, and treatment that works for one individual might not be the best treatment for another individual. Certainly, if you take a medication, you have a pretty good idea what to expect. The doctor will write a prescription, you'll take the medicine, but he or she is going to ask you about your symptoms, so you need to be prepared to talk about the things that have been bothering you. Now, when we talk about psychotherapy, I really do need to prepare you a bit. What people with PTSD do very, very well is avoid thinking about what happened to them. They're very, very good at not thinking about the traumatic experiences. They're very good at avoiding any kind of situation that may remind them of the terror that they felt when the roadside bomb came into their barracks. So what the therapist is going to ask you to do is, in some respects, precisely what you spent all your time not doing, and that's they're going to ask you to talk about the traumatic experience. And you got to be prepared for that. So what we've discovered so far is that the treatment is successful if you're willing to engage your demons, if you're willing to confront the memories that keep you up at night, that haunt you in your nightmares, that you're trying to avoid, that are causing you to shut down emotionally. And that's not easy. That's a tall order. That's why you really need to be ready to come. And if you're not quite ready, we can help you get ready. But once you decide to get treatment, you've got to realize that you're deciding to do some really hard work, but there's going to be a major payoff if you're willing to engage in the effort.